Today I'm going to discuss the findings of our current systematic review. In this project, we explored the evaluation of extramotor symptoms and the assessment tools used in clinical trials of subjects with amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, or ALS, is the most common subtype of motor neuron disease and is often used to refer to the condition as a whole. ALS is a disorder primarily affecting the motor neurons, resulting in progressive weakness and eventually respiratory failure. There is currently no cure, and only globally licensed treatment, riluzole, has limited efficacy, extending survival by just a few months. We are beginning to understand the additional effects of this condition on the individual. Extramotor symptoms in ALS, including problematic saliva, neuropsychiatric symptoms, cognitive impairment and behavioral change, pain, fatigue, and disturbed sleep are common and impactful. We wanted to explore if and how these extramotor symptoms are evaluated in clinical trials. We reviewed clinical trial databases and PubMed for trials between 1994 and 2020. This enabled us to include the licensing trials for riluzole. 237 trials were included. We found that extramotor symptoms were under-evaluated, and that where evaluated, it was often within measures which were not specific to that symptom or suitable for people with ALS. Extramotor symptoms were often evaluated within larger assessments of physical functioning and quality of life, often with simple presence versus absence questions, meaning symptom-specific changes were often not evaluated or reported. In addition, assessment tools which are not designed for or adapted towards people with ALS and the progressive physical disability and communication difficulties that they may have may not be suitable to evaluate these symptoms. We recommend that future trials include extramotor outcome measures for people with ALS to consider the additional potential therapeutic benefit of candidate drugs and use measures which are suitable to evaluate these symptoms within the ALS population.